So hello everyone, this is dental plaque part 2. So those who haven't watched dental plaque part 1, please go and check out that video also. So in today's video, I am going to explain you some more things about dental plaque, like classification of dental plaque. Okay. Based on this classification is based on the relationship to gingival margin. So I think you all knows what is gingival margin. Okay, this is tooth, this is root, this is the hard structure, okay, and the soft tissue over this, and it is lined by a soft tissue which is known as gingiva, and this portion, this is the marginal gingiva. Okay, so based on the relationship to marginal gingiva, our dental plaque is classified into supragingival, which is above the gingiva, and subgingival, which is below the marginal gingiva. Okay, so supragingival, which is above the marginal gingiva, and subgingival, which is below the marginal gingiva. Okay, now this supragingival and subgingival further classified into, first supragingival, this is further classified into coronal plaque and marginal plaque. Okay, so as it is supragingival, so this is very obvious that it is above the gingiva, above the marginal gingiva, so we don't have to see below it. Okay, so only two cases comes here. Either it is on the tooth surface, anywhere on the tooth surface, or it is near the margins. So that's why coronal plaque, the plaque associated with the tooth surface. So coronal plaque is a plaque which is in contact with tooth surface only. Okay, so marginal plaque associated with, yes, tooth surface, but at gingival margins. Okay, now this is all for the supragingival. Now we need to explain the subgingival one. Two types: attached plaque and unattached plaque. So the attached plaque is the one which is attached to the gingiva, and unattached is the one which is not attached to the gingiva. So the attached one can be further classified into three categories. The one which is attached to tooth, or we can say tooth associated plaque, and the one which is attached to epithelium, or we can say epithelium associated plaque, or the one which is attached to connective tissue, or we can say connective tissue associated plaque. Now the one which is attached to tooth surface is associated with calculus formation, Okay, root caries. Okay, root resorption, and slowly progressive periodontal destruction. Okay, and the one which is attached to epithelium. So this plaque is usually adherent because it lacks interbacterial matrix and in direct association with gingival epithelium. Okay, and the one which is attached to connective tissue, this usually demonstrates enug and localized juvenile periodontitis. Okay, so this is all for the classification of dental plaque. Now one more thing I want to tell you is the composition of dental plaque. Okay, so for composition, see, microbial plaque is, what is it? It is bacteria plus intercellular matrix. And 1 microgram of dental plaque contains up to 250 millions bacteria. So 1 mg of dental plaque contains up to 250 million bacteria. Okay, and what all else in the composition? Non-bacterial microorganisms like yeast, mycoplasma, protozoa, and viscosus. Okay, these all are also seen in small amount in plaque. Okay, now this intercellular matrix accounts for 25% plaque volume. Okay, this intercellular matrix accounts for 25% of plaque volume. Okay, and what is inside this intercellular matrix is some organic materials and some inorganic materials. Okay, so organic materials include polysaccharide protein complex, proteins such as albumin, carbohydrates, lipids, and inorganic includes calcium, phosphorus, and small amounts of magnesium, potassium, and sodium. Now one more thing, and that is role of dental plaque in periodontal pathology. Okay, so bacteria present in dental plaque leads to various perio problems. Okay, so what happens here is gingival sulcus and periodontal pockets consists of plenty of gingival clavicular fluid. Okay, so gingival sulcus and periodontal pocket consists of plenty of gingival clavicular fluids which flows outwards from the base of pocket Okay, so to colonize bacteria must adhere to the available surfaces for preventing the displacement of fluid flow. Okay, so adherence represents a virulence factor surfaces which are available for the attachment of bacteria. So to colonize, bacteria must attach to available surfaces for preventing the displacement of fluid flow. So adherence represents a virulence factor surfaces. So adherence represents a virulence factor surfaces which are available for attachment of bacteria, and these surfaces are what all these surfaces are inside the oral cavity. These are tooth or root, these are tissue, okay, these are pre-existing plaque. Okay, these are tooth or root, tissue or pre-existing plaque. So in tooth or root, actinomyces viscosus binds to proline rich protein which are found on saliva coated tooth surfaces. Okay, and for tissue, P. gingivalis binds to connective tissue components P. gingivalis binds to connective tissue components like fibrinogen and fibronectin. Okay, fibrinogen and fibronectin. And for pre-existing plaque, A. actinomyces viscosus binds to the polysaccharide receptor which is present on the cells of Streptococcus sanguinis. Streptococcus sanguinis. Okay. One more thing you need to know is process of tissue destruction results from elaboration of bacterial substances that directly or indirectly causes degradation of periodontal tissue. Okay, so process of tissue destruction results from elaboration of bacterial substances that directly or indirectly causes degradation of periodontal tissue. And one more thing you need to know is periodontal pathogens invade the periodontal tissue and evades the host defense. So what periodontal pathogen does? Periodontal pathogens, what they do? They invades the periodontal tissue. They invades the periodontal tissue and evades the host's defense defenses which causes infection and damage of periodontal tissues. Okay. Now, how bacteria enters the host? Okay. See, we read that the periodontal pathogen invades the periodontal tissues. But how? How periodontal bacteria enters the host? So bacteria enters the host by 3 processes. Okay, 1, 2 and 3. Okay, so first of all, what it does, it penetrates directly by widening and rupturing intercellular spaces of stratum spinosum and perforation found in basal lamina. Okay, so first How the bacteria enters the host? The first process is by penetrating directly. It penetrates directly by widening and rupturing the intercellular spaces, or any perforation they found in basal lamina, they can enter through that. Okay, this is the first thing. And second, they also penetrate through the ulcerations in the epithelium sulcus or pocket. So any ulceration in epithelium of sulcus or pocket, they can also penetrate through that. And third thing is how they penetrate. They can also invade through micro holes present in the surface created by transmigration of leukocytes. Created by transmigration of what? Leukocytes. Okay. By these three processes, bacteria enters the host. Now the pathogens which enters the host are, what all pathogens they are? They are Actinomycetes, M. competens, and P. gingivalis. Okay, so these are the pathogens which enter the host. And what they do? What they do is they suppresses the host defense cells. Okay. Now this A. actinomycetes M. competens, what it does? This secretes exotoxins like leukotoxin, so which inhibits the function of polymorpho-neutrophils and also capable of killing mature T and B cells. Also capable of killing mature and T and B cells. So this actinomycetes M. competens secrete exotoxin like leukotoxin, and this leukotoxin further inhibits the function of PMNS, polymorpho-neutrophils, and also capable of killing the mature T and B cells. So these pathogens releases various enzymes. So what all the enzymes are? They are collagenases, gelatinase, hyaluronidase, aminopeptides, acid phosphatase, and alkaline phosphatase. Okay, so these enzymes are released by pathogens, and what they does? They causes destruction and periodontal disease manifestations. Okay. So how gram-negative bacterial cells causes destruction and causes periodontal problems? So the lipopolysaccharides lipopolysaccharides of gram-negative bacterial cells. So the lipopolysaccharides of gram-negative bacterial cells has complex lipid, okay, has complex lipid like lipid A, okay, which attaches to the polysaccharide. So which attaches to the polysaccharide, and this lipopolysaccharide is known as what it is known, and this lipopolysaccharide is known as endotoxin, as it firmly bound to tooth surface and released only when cells are lysed. Okay, so this is how gram-negative bacterial cells does the lysis of cells. Okay, and many other gram-negative bacteria which are present in periodontal pocket they also lead to release of endotoxin. Endotoxins, and these endotoxins interacts with the receptors on macrophages and monocytes which further releases cytokines like interleukin 1, and tumor necrosis factor. And this is how also they can cause the periodontal problems. Okay, and endotoxins also causes leukopenia and plays an important role in pathogenesis of periodontal disease. Okay, and one more thing you need to know is okay, now peptidoglycans which are found in the bacterial cells what they does, they stimulate bone resorption and also induces macrophages to produce prostaglandin and collagenesis. One more thing is capsular substance which is found on the outermost surface of bacterial cells, which is found on the outermost surface of bacterial cells and leads to what? It leads to tissue destruction. One more thing I need to tell is specific and non-specific plaque hypothesis. Okay. Now, who gave this? So, Walter Loeschy in 1976 proposed this hypothesis. Okay. Now, this hypothesis is non-specific and specific. Okay. Non-specific and specific. So first of all, I'll explain you the non-specific hypothesis. Okay. So it is the total bulk of plaque which determines the pathogenicity rather than individual species. Okay. So what non-specific hypothesis said? It says it is the total bulk of plaque which determines the pathogenicity rather than the individual species. Now, when small amount of plaque is present, the products released gets neutralized by the host. Okay. So when small amount of plaque is present, the product released from that gets neutralized by the host. The host can neutralize that. So hosts have the ability to neutralize that. And when large amounts of plaque produce large noxious products which overwhelmed host's defense. Okay. This is similar to the class. If in a class of 40 people, only 1 to 2 people are naughty or creates disturbance in the class, teacher can easily handle that. But if the whole class or the noxious or there is a bulk of people, bulk of children who are very noxious, so it becomes difficult for the teacher to handle them. So similarly, when large amount of plaque produces large noxious products, that overwhelm the host defense, and if the small amount of plaque is present, that can easily neutralized by the host. Okay. Now the concept is control of periodontal disease depends on the control of plaque accumulation. Okay. So what this tells you, what non-specific hypothesis tells you, that if the small amount of plaque releases small amount of noxious products and can be easily neutralized by the host, but if the plaque is more, it will release more noxious products and it becomes difficult for the host to handle that. Now the concept is simple. Control periodontal, if you want to control periodontal disease, control the plaque accumulation. Okay. And what specific hypothesis tells you? Not all plaque is pathogenic, but there are certain specific microbial pathogens in plaque which are responsible for pathogenicity. So this specific hypothesis tells us that not all plaque is pathogenic, but only there is a specific microbial pathogens in plaque which are responsible for the pathogenicity. Now here some specific microorganisms. Specific microorganisms are responsible for periodontal disease. Okay. Comitants responsible for localized juvenile periodontitis. Okay. So this is all about specific and non-specific hypothesis. So if you are interested in more such kind of videos, please do subscribe to my channel and press the bell icon so that whenever I will upload any such kind of video, you will get notified. And thank you so much for watching and love you all guys. For example, actinobacillus, actinomycetes M. comitants responsible for localized juvenile periodontitis. Okay. So this is all about specific and non-specific hypothesis. So if you are interested in more such kind of videos, please do subscribe to my channel and press the bell icon so that whenever I will upload any such kind of video, you will get notified. And thank you so much for watching and love you all guys.